Hello and welcome back to another Mental Health COVID-19 webinar. This is our fifth webinar. We've got a great panel for you. We've got a fantastic discussion today, which is all about public health information. Now, a few reminders before we begin. My name is Niall Boyce. I'm the editor of The Lancet Psychiatry, and these webinars are a joint effort, really, between The Lancet Psychiatry, United GMH, MHPSS, the Mental Health Innovation Network, and we've been very grateful for the support and enthusiasm of WHO. Now, this session is being recorded. If you're on Twitter while you're watching us, please stay on Twitter and use the hashtag COVID-19MH to let everyone know about what we're discussing today. So without any further ado, I'm going to introduce our panelists. We're joined by Alison Brunier from WHO, by Pattie Gonsalves from Sangath in India, Taha Sabri from Taskeen in Pakistan, and Suzanne Farrell from Public Health England. We hope to be joined by one of Suzanne's colleagues, Ian Walker, also from Public Health England shortly. Now, those of you who have been watching for the past month or so will be very familiar with our format. I'm going to start off by talking to each of the panelists in turn about a specific area of their interests. Then we're going to throw things open for a general discussion and indeed for the questions which you have emailed us online. And if you haven't emailed us a question yet, please feel free. Please send in a question and I'll see if we can get time to answer it. So I'd like to start with you, Alison, and I wonder if you could give us the big picture. What has WHO been doing to help countries to design and deliver their public health information campaigns?
Okay, well, first of all, thank you very much, Niall, and thank you to United for inviting me to join this webinar today. Delighted to be here. Well, first of all, I just wanted to say, as I guess most people who are listening to the webinar are aware, WHO has been communicating about on all fronts, actually, about the COVID-19 pandemic from the very beginning. And what we had to do fairly early on, we realized we needed to take a fairly hard look at the way that we communicate in order to be more effective and in order to reach many more people much more quickly. So there were three things that we looked at particularly to try and do a better job. One, we've started making much broader use of research on people's attitudes and people's behaviors to the pandemic. We've got a company looking at more than 50 countries that provides us with information on a rolling basis that enables us to shape our messaging so that it's appropriate to what people need to know and want to hear. Secondly, we've had to broaden our partnership base. One of the sectors that I wanted to mention is with the tech industry. We're working much more proactively now than we were in the past with some of the big tech players in order, one, to be able to reach more people with our messaging, and secondly, to also prevent some of the misinformation and the rumors that we're seeing all around the world from circulating widely. And the third thing I wanted to mention was languages. For those of us that know the UN system, we generally try and make sure that we communicate the most important information in 6 UN languages. We've gone a lot further than that this time. We've had a lot of support as well from the outside so that we can communicate in many more languages, particularly languages that are spoken very widely around the world to reach a much broader audience.
Yeah. Now, Alison, you've talked about this broad audience, but one of the problems is that this broad audience consists of lots and lots of different groups, all of whom have different languages, of course, but also different ways in which they will process information. And one of these groups, of course, is children who have been very much affected by this crisis in terms of school closures, in terms of the economic impact on their parents. What do you think can be done in order to communicate effectively with this particular group?
Well, it's a very good question and, of course, an important one. And there's certainly not one size fits all when it comes to communication. We, of course, work very closely with UNICEF when it comes to children and with groups and organisations that are more communicate more with young people. There's one specific project that I wanted to mention, though, which was a good example of how one can communicate effectively to children, and that's a storybook project that some of you may have heard of, that was produced, a storybook that was produced just a few weeks ago, and it was a collaboration of WHO, UNICEF, a number of other UN players, and over 50 humanitarian partners working in that space, to come up with a storybook designed for 6 to 11-year-olds to explain not only how in simple language that they could understand, not only how they could protect themselves and protect their loved ones, but also how they could manage some of the difficult emotions that come to light when you're faced with circumstances such as we're going through now. And we were able, through the enormous support that we got from the outside, once we launched this in a few languages, we now have versions in either finalized or going through production in over 100 languages. The book is being used in different ways, through audio versions, through storytelling, in humanitarian situations in Syria, in Iraq, in Nigeria, etc. So that's just one example, but again, it comes back to the partnership issue. We couldn't have done this on our own. It was only through this collaboration with a lot of partners who had experience in this space that we were able to work on a project like that.
Okay, so it's a combination of innovation and partnerships, I think.
Correct.
And so what I'd like to do is now turn to Pattie to tell us a little about the situation in India, about how, for example, the Indian government is educating people about COVID-19 and maybe even about the mental health issues associated with this.
Sure. Thanks, Niall, for that question. And just to echo what Alison said, very glad to be here. So thank you for inviting me, and thank you to United as well. So in terms of what the Indian government has done, COVID education has been on sort of via all public broadcast mediums. So whether this is, radio, TV, or even sort of caller ringtones. So if you sort of call someone, there's a sort of tape message about COVID, and a range of different public information campaigns through a new website that the government launched a few weeks ago, specifically around COVID. And also setting up an online resource center, as well as an app that is soon to be mandated, where everyone might have to download this. But I think the important thing to say here is that almost all of this information is being sort of curated or supported by civil society agencies. So this sort of burden of providing information as well as caring for people's mental health has fallen on this civil society or the NGO sector. This being said, I think the positive side of this is that there's also been an absolute explosion of online and tele initiatives, whether this is, information about COVID and mental health, online phone counseling, a range of social media initiatives, many webinars, even such as the one that we're on. But most of this has tended to take a digital first approach. And sort of given that there's equally been a lot of misinformation. So the point also that Alison raised about sort of attitudes and behaviors, there's been a lot of stigma, even ostracism against healthcare workers, for example, in India. So I think the point of the digital first approach, while it is extremely valuable and essential, it's also extremely equity insensitive, because it does not consider a vast majority of the country that does not have this kind of internet access or even telephone or television.
So what is being done for this majority who don't have access? What can you do on that?
Not very much.
Oh.
Not much, but one of the initiatives that we feel, and I'll just share an example, is also just strengthening face-to-face initiatives, because digital is not a feasible option there. So while of course considering safety, one of the sort of initiatives that Sangath is embarking on is through a partnership with an organization called SEWA, which is the Self-Employed Women's Association, through which Sangath will be training women's support groups to deliver psychological first aid and support in Madhya Pradesh, which is a state in central India. So this is one, it might sound sort of old school, but the digital first approach may not be applicable for everyone. So I think we don't want to throw out the face-to-face approaches where they are needed.
Okay, so a note of caution there, because people who've been watching these webinars for the past month or so will have heard an awful lot about this being the moment for digital mental health. But what you're suggesting, Pattie, is that we've got to be very careful that doesn't blinker us to many people who can't access digital, and maybe lower tech solutions, which would be more appropriate and indeed effective.
Sure. Yes, and I
Thank
mean,
you.
and I don't think this is just unique to India. It's across countries in Asia and sub-Saharan
Yep.
Africa as well.
Thanks. So with that in mind, I'd like to talk to Taha. Now, I know that Taskeen has recently been putting together its own public health information campaign in Pakistan. And I wonder if you could tell us a little bit more about this campaign, about Taskeen's role, about how this all works.
Thank you, Neil. While there is some focus on general COVID guidelines by the state, there's little to no attention being given to mental health. So as a result of that, the Taskeen embarked on this digital campaign in which we started developing animated content, because we couldn't film high production, we couldn't film live productions because of physical distancing aspect. And so far, we also, because of that, we have made a bit of an impact, and also formed a coalition with other organizations in Pakistan who are then delivering services to those we identify suffering from COVID-related mental health issues. And now we're also in talks with the state of how to scale it nationally. But the biggest learning that we've had is that, as I think I would like to add to what Pattie says, that over the weekend I went to this a small rural village outside Karachi for a ration distribution drive, because they don't even have any food and anything because of the lockdown. And when I reached there, I realized that our entire messaging was excluding them, because let's say that the house in which I live in, so literally the same, and in this house I think around 4 people live. Within the same space in that village are 10 households with 100 people. So the very concept of physical distancing is sort of ridiculous for them. In fact, it will only provoke more anxiety and more fear, because most of them don't even have water. So the entire concept of washing your hands after every 10 minutes for 20 seconds is kind of ridiculous. So in a way, what I feel is that the precautions and the guidelines is worsening the mental health of these underprivileged communities, because we are developing them from the perspective of high-income communities and high-income societies, and the strata in our society which has access to the digital media, which is the high-income group. So as Pattie says, that I feel that although we are doing something, but we have realized that we need to develop a completely different strategy, completely different messaging, and maybe have to conduct some anthropological research about the specific impact of COVID on low resource communities. So that is something which we feel is very, very important to start a conversation around. That is our messaging for the masses or for the few. So I think that is a very important conversation.
So this gets us to a slightly different place in which we started. We started very much focusing on the experts getting the message out there. But what you seem to be saying, Taha, is that we also need to be getting some information back. So we need to be getting information back from communities as to the situation at the grassroots, as to what sort of information is actually pragmatically useful and helpful, and other types of information which are just going to induce a lot of anxiety, helplessness, hopelessness, and be counterproductive.
Exactly.
So I'd like to move over to Suzanne and Ian now. Now, those people who are online from the UK will be more than familiar with the adverts we've been seeing on TV, with the stern tones of the actor Mark Strong telling us to all stay at home. But I wonder if you could tell us a little bit more about the public health information campaigns which Public Health England have been doing specifically on mental health at this time.
Certainly. So in terms of the campaigning and public messaging work we have been doing, hopefully people will have also seen the slightly more cheerful yellow brain of Every Mind Matters in some of our television adverts if you're here from the UK. So last October we launched a new mental health literacy campaign, so very much focusing on what at population level individuals can do to look after their own mental health and well-being, but also with clear signposting where people do need further support. That meant that leading up to October of last year, we'd done an awful lot of work in terms of insights gathering on how to deliver those messages. A lot of that is digitally, but huge parts of that were around partner working and delivering those messages in locations such as pharmacies and GP surgeries. So we've really had to rethink some of that work as well. But since coronavirus, we've been able to look at that asset and tailor it so that it is now more relevant for individuals staying at home, and to bring in more materials around those particular issues that people are struggling with, so working from home, social isolation, and the specific anxieties that that people are experiencing at the moment. That's an adult campaign, and alongside that we have a project called Rise Above, which is for young people aged 10 to 16. So again, we're sharing similar messages through that campaign, but delivered much more through influencers and people that young people will engage with much more. So we have that kind of more active campaign work. Over the last couple of weeks, we've been doing television advertising, a lot of PR work, trying to not just promote linking through to the website, but also actual embedding of actions people can take. So if the only thing they see is a written article, at least they're getting some information there as well in terms of thinking about that non-digital group. Alongside that, we've complemented that with guidance for adults and for parents looking after children and young people, which is part of the wider gov.uk suite of guidance products as well.
So what have been your biggest challenges in rolling out these various initiatives?
I think one of the key challenges has been looking at the delivery model being different. We've previously had a huge amount of success and support from partners who are now not operating in the way that they once were. So thinking about how we can deliver that differently. And just responding to the sort of changing attitudes of the public and the changing position in terms of the wider policies that the government has in place around coronavirus. So needing to kind of constantly review and make sure that we're in line with the latest guidance on what people can and can't, well, are recommended to do, and also that we're hitting the key themes that people are concerned about. So we've seen mental health really increase in the awareness of people in terms of the issues they're worried about, but how do we make sure that we're surfacing content on issues such as, you know, financial concern or worries about abuse at home, or, you know, concerns about the workplace. So having to be quite responsive to emerging issues.
Thanks. Now, although it seems in some ways as if this lockdown has been going on a very long time, we are still very much in the early days of figuring out what works and collecting the data. But I wonder if I could put this question actually to all of the panel, which is, what have you found so far seems to work, and what is the evidence for that? I wonder, Ian, if you have any thoughts on that.
Yeah, thanks, Niall. So I think some of the work we've been trying to do is some of what you were talking about, of getting the data back from the population to understand exactly how their mental health is faring through this pandemic. So we've been trying to gather as much data as we can from different community surveys, population surveys, data coming from polling organisations in the UK, to try and understand exactly how the mental health is faring. Both early on in these stages, but also the sort of trend as we go forward, to understand how the mental health of the population would unfold. And that includes some work on subpopulations, so more vulnerable groups, to understand how their mental health is faring at a population level. And what we're hoping is that will help us to tailor some of the messages to those key groups, to understand which groups we maybe need to target more specifically, and what kind of messages might therefore be helpful to those. So it's early days, but we're hoping that data will help us to really understand where things are at. I appreciate for not every country maybe has the scale of data accessible, but we've been fortunate in a number of research studies that are gathering community survey data, and that's really helping us at the moment. And we're exploring how we can really use that to gauge and inform our response and the messaging we're giving to the population at large, as well as subgroups within it.
So Pattie, I wonder what you found works.
My response is somewhat similar, which has been, at least for the work that we've been doing online, one of the ways that we've just asked people what is it that's on their minds, so that messaging is also being responsively tailored. And we've been doing this particularly focused on young people online, which is through creating spaces for them to just talk with a mental health professional for 45 minutes. We primarily use Facebook and Instagram to curate sort of live sessions. And asking them what they want to discuss. And some of the topics that have come up they're quite consistent with what we're seeing in other countries, which is around, one is just sort of acute reactions of worry, anxiety, stress, but even talking about things like employment, aspirations, studies, careers, which the vast majority of people in India are young people, and their sort of study career trajectory has been quite profoundly impacted at this sort of point, which is the point where the national exams happen, which sort of determine, for many young people, the entire course of their employment futures. And then the second thing that seems to have worked is signposting people to appropriate online sources. But again, just to sort of caveat all of this by saying this is only catering to that group who is accessing these kinds of online platforms. And having a range of options has been excellent, because we've actually never previously had so many different online portals to direct people to. So that's been great. And there's even, I think, people are focusing more on specific vulnerable groups as well, whether these are young people facing violence or abuse at home, LGBTQIA young people, or sort of other minority communities. So these have been a couple of things that have helped. But yeah, just I think asking people what it is that's on their minds, and knowing that this might keep changing as the weeks go by, and being really responsive to that.
Yeah, so it's that sort of flexibility and responsiveness that seems to be the successful strategy. Is this your experience, Taha?
So I would agree with Ian and Pattie. And for us, I think what we feel really works is three things. First is demedicalisation. The second is indigenization. And the third is collaboration. So the first aspect, we must, the language that we use for the masses must be very, very simple. And we must not scare them with medical terminologies. The illness model, we must not use that for prevention. We must use the wellness model, a resilience model, a hope model, with colors and lights and all. So I think that is very important to give hope and to foster resilience. The second aspect is indigenization. We must understand the local cultural context. We cannot copy paste stuff from different cultural contexts. And for that, we must interweave our content with the local cultural coping mechanisms, as well as events. For example, we've sort of weaved our COVID mental health campaign with Ramzan, which itself is a time of isolation, spiritual growth, and a form of self-improvement and relationship improvement. So we weave those concepts in with Ramzan, and the values of Ramzan, which include like generosity, giving back to the poor, and all of that. So we're sort of like looping that in with the sort of response. So I think so that is very, very important. Indigenization to the local cultural context. And third is collaboration. None of us can do it alone. And the situation is such that almost everyone is becoming aware of the mental health impact of the crisis. Companies are coming to us. The provincial government has come to us. The federal government, we're also in talks with them. Media channels, we're in talks with them. And that's how we've been able to reach around 10 million people so far, because of our collaborations. We didn't have the resources ourselves. So the third most important thing in this time is collaborating, partnering, learning, and that's the only way that we can be effective.
Now that's very interesting, because one of the things in the first webinar we did, Professor Neil Greenberg from King's College in London mentioned that altruism might be a very effective way to communicate, that not so much sternly saying do this or do that, but also appealing to people's better instincts of caring towards others. Has this been your experience, Alison, or what other things might have worked from WHO's point of view?
Well, firstly, yes, in response to your question about solidarity, and one of the words that we've been using most in the last weeks is the importance of solidarity during this this pandemic in order to bring us out the other side, but also on an individual basis, being kind to one another, people who might need specific help, older people who are isolated, ensuring that we take care of one another. But just coming more broadly to specific factors of success, if you like, or that have helped us improve our communications. One, as with all the other panelists, again, the importance of monitoring what's being said. We do daily media monitoring, monitoring of social media on an international level. And for those of you that are familiar with WHO's structure, we also have, as well as the headquarters, our 6 regional offices and 150 plus country offices who also feed information on what's happening at the country level. The second thing I wanted to mention was trying new approaches. We've definitely become I would say less risk averse than in the past and open to trying new approaches, whether it be new apps in different languages, a concert of not just music stars, but presenters, TV presenters, general public, whether it be working more with our ambassadors, and the ambassadors, by ambassadors I mean not just those that are officially ambassadors for us, but all those people well known and not so well known who have become, if you like, friends of WHO over the years and know our work and know our networks and have their own networks who can help us get messages out to a wider public than we're able to alone.
One thing which I'd like to talk about now is unintended consequences. And if we consider health messaging to be an intervention, of course, it's rare to find any health intervention that doesn't have some undesirable side effects. One of the concerns I've heard is that the health messaging around COVID-19, while of course deeply, deeply important, has also possibly got the consequence of adverse effects for people with health anxieties, for people with who are experiencing obsessive compulsive disorders. I just wonder about these adverse consequences and what can be done to mitigate that, whether it's through targeting or how the message is altered. I wonder if anyone has any thoughts on that.
I think from the UK, we've tried to incorporate messages, as I know other people have, on trying to limit engagement with media and social media around the messages, and I think that can be really important for some of these groups of people, that they're not overloaded with these messages constantly, but they're ensuring they're taking breaks from accessing media, because that can fuel a lot of anxiety and some of the concerns that you raised. So I know that other countries are offering similar messages, but for us I think that's been a key thing to try and communicate to the population, to really be aware of how much they're consuming and how the impact that's having on their mental health.
Right,
I
so
think
it's also... Sorry, go on, Suzanne.
I was just going to say, to build on that as well, I think the other thing we're conscious of is that there are those particular populations that are at risk, and there's some excellent work in the wider charity sector in terms of messaging there, which we've brought into our guidance as well. So, you know, for example, advice for those with OCD on how to manage some of those messages around hand washing, so kind of specific advice for those groups as well.
Yes, I don't know if, Alison, you have any thoughts on this about potential adverse effects of health messaging and what can be done?
Yes, and it's a very important topic, I guess, for anyone that's involved in risk communication. What your goal is to try and bring people's levels of concern up to the same level of concern of the experts. So not so much that they're panicking and are unable to do anything, and not so much that they're completely apathetic and aren't taking any protective measures at all. So you want to try and reach that level where people will know how to protect themselves, will not be panicking and unable to do anything, and are able to follow public health advice. I mean, one of the things that one of the specific messages that we do put out a lot is during this time that's very difficult for many people for many reasons, not to be too hard on oneself, and that quite often you're not going to be able to achieve what you would normally achieve in a day, but to set small goals that you are able to achieve. Be aware that there are constrictions that you can't overcome. Be aware of what the limitations are, and congratulate yourself on the small things that you do achieve. So that's something that we do try and communicate on a regular basis in most of our messaging on mental health.
Thanks. Well, yes, we've all seen the tweets going around saying that, you know, while you're in lockdown, you should do the equivalent of Newton discovering gravity or Shakespeare writing King Lear. I don't think any of us are quite up to that. But this matter of tailoring messaging, I wonder if digital might have a role there, Pattie.
Digital in terms of tailoring messaging?
Yes, in terms of delivering messages to specific groups, which are sort of tailored to maximize the benefits and minimize the adverse effects.
Yeah, and I mean, I think one of our sort of insights or suggestions for sort of how to tailor messages is also that you need to be quite specific. So, you know, make the message specific to someone, whether it's, for example, messages for children, messages for parents, messages for health workers or people at the front line. In a country like India, it's a hard to reach population with migrant workers who have been extremely adversely impacted, and there is no messaging going to them beyond what journalists are sort of putting on the news, and even that, I mean, you don't know how much of it is being consumed. But would be, you know, get the information right, but make it really specific and useful. So if you're telling, I mean, we've been doing things like, for instance, videos that are specifically for mums who are at home taking care of their children who are not in school, messages for young people who are living alone, messages for specifically for young people who already have an existing mental health problem or a serious mental illness. So people have different needs, and the messaging really needs to tailor to them. And again, I appreciate the need for very quick messaging, but I think in doing it quickly, there's also the risk of being too general and, you know, broad strokes. So I think it takes time to build that nuance into messaging, and we haven't had a lot of time over this last 2 or 3 months to put that together. So I think this next few weeks and months is that opportunity to do that.
Yeah, so I think the feeling I'm getting from the panel here is that we need nuance, and also just frankly to tell people to give themselves a break from the media, and give themselves personally a break from high expectations, overly high expectations. And this relates to a question which has just come through over email, where Professor Murthy from Bangalore in India says, the key challenge is empowering individuals to recognize and use skills for mental health, what I would like to call empowering for emotional health. What are the experiences in this area? Now, this touches on something I think which you were talking about, Taha, about empowering individuals as well as simply delivering a message to them.
Yeah. So what we focus on is resilience. What we focus on is developing resilience, and how we define that is adopting and practicing healthy coping skills to deal with distress, right? And that's what pervades our messaging. Practice healthy coping skills. Practice healthy coping skills. Avoid unhealthy coping skills, which may help you temporarily, but in the long run they are harmful. So that's how. So that is what our main messaging is. But also going back to the question about targeting the messaging. So what we've done is that we've created an entire target segmentation in which some of the targets we've identified are basically people living alone, parents living with families, parents caring for small children, parents caring for adolescents, people living with mild mental illnesses, caregivers caring for people with severe mental illnesses, people taking care of the elderly, people who've been diagnosed with COVID, caregivers of people who've been diagnosed with COVID, and then people like healthcare providers, police officers, media personnel. So like we've created this entire, and we're developing content specific to each sort of segment. So this, we've already developed around 10 animations, and we have around 10 to 15 more on the line. So I think I completely agree that the messaging needs to be very, very specific. And one more aspect is stories. Stories really gain attention. Instead of, let's say, just a white man telling you that is number one, number two, number three, number four. If you have stories of people in their situations, right? And through stories, you can teach a lot. And also humor, that's also very, because at the end of the day, we want to lift people's spirits up. So we don't want to give them more like grave news that take care of yourself or you will develop mental, so that those things won't work, and they'll stop watching after like 7 seconds. On digital, like 7 seconds is the concentration span, right? So it needs to be funny, it needs to have a message, it needs to have a story, and it needs to be culturally adaptable and specific. So I think those things really work. Those are really effective. Yeah.
Thanks. And one of the things which strikes me is that health messaging of all sorts has always been very strong on what I'd call always or never messages. You know, never smoke, always eat your greens. But in this situation, we're in a bit of a moving target situation, in that eventually lockdowns will ease, and that the messages that people have had to absolutely stay home and not go out and so on, those are going to need to change a bit. And I know I read over the weekend, I think that David Spiegelhalter was saying, well, you know, maybe this messaging is a bit too effective, and there's going to be a bit of an issue with people having the confidence to resume some degree of normal life as lockdowns end and as this situation moves on. So I just wonder if the panel has any insights into this as to how we can shift the messaging, and whether insights from what we know about mental health in terms of giving people that confidence and empowerment, whether that might be of use in the situation.
I can.
Suzanne, yes.
I suppose, I mean, I think it comes back to what we've already been talking about, which is it will be about testing and reflecting on what's working with the public. So certainly in all of our messaging, that's what we have been doing as we've gone along. But I think incremental small steps is something that has been really helpful and received very well by the public in the work that we've done so far. So it's not go for a run, you know, 3 times a week. It's start with a walk around the block and go from there. So it's about building up people's confidence, and of course the messaging around mental health will need to be aligned with very clear broader public health messaging around coronavirus.
Yes, and I suppose some of this as well is helping people to understand what's normal in these situations.
Niall.
Yes, Alison, go on.
There will also be the question of messaging for
Okay, Alison, I'm sorry, you've just cut out.
Okay, I was just going to add that another.
Okay, go on.
Can you hear me?
Yeah, I can hear you now.
I was just going to add that as more people come out of confinement and more people go back to their usual places of work, there'll also be the messaging for managers, for employers as well, on how to help their employees come back to work in a comfortable environment. Of course, there'll be the physical distancing measures that will need to be put in place that many employers are already preparing for, but there will also be changes in the way people work together. There won't be so many people in close proximity. A lot of people may still be teleworking for a number of weeks or even longer. So there will be that aspect as well of providing mental health and psychosocial support in the workplace as well as people go back to work.
Yes, I was just thinking as well about the thing which Taha said about demedicalisation, and the fact that there's a degree of messaging that a degree of anxiety is normal in these situations, and helping people to deal with that, and saying, you know, to recognize these feelings and nevertheless to move on out of lockdown and to move on with life. Do you think that that's the case, Taha, that the demedicalisation which you talked about is going to be useful in the longer term as well?
So Neil, the way that initially when the crisis started, so we looked at it as like a 1 month, 2 month sort of disaster. But now what we're planning for, of course we hope for the best, but what we're planning for is 2.5 years of a partial lockdown, because we assume that until a vaccine comes, and of course London will get a vaccine before Karachi does, so it'll take much more time for it to get here. But for our developing countries, we expect the vaccine will come much later. So we are looking at the next 2.5 years of probably the impacts of the crisis happening. And in terms of the messaging, I think we need to be very, very careful. We cannot speak in absolutes. It must be there must be a lot of nuance, and it must be very specific, and it must be very flexible as well, right? So, for example, if we are saying something today, then we must be ready to. If we get some thing which challenges our current knowledge, we must be ready to change our thinking and not hold on to old ideas and not be stubborn. Because that's a big issue. I have a big issue with this, and I'm sure other people do as well, that once you've done something, so like you just like hold on to that. So we must be very, very flexible and nimble and be ready to also and I think we must also be like comfortable with saying that we don't know, because I think that that just that because of course rather than it increasing uncertainty, I feel that it will also save our faces, right? For example, if we state something which turns out not to be true in a couple of months, then of course we will also lose our credibility. So also for our credibility, we must learn to say we don't know, or that we are uncertain. I think that's very, very important. If you think of a long-term sort of approach, because at the moment the biggest issue is fake news, and the biggest problem is credible. The very few credible organizations. The WHO is a credible organization, and the states are somewhat credible. But if organizations like us, like our organizations, lose their credibility, so then no messaging will work. So in that case, I agree. We need to be very, very careful, very nuanced, and also be fine to admit that we don't know exactly what's going on. So yeah.
Well, that's great. That's actually answered in advance one of the questions which has come in, which is someone's asked, how do you build trust in the population? It sounds like one of the ways to build trust in the population is to be honest about the limitations of our knowledge. So we only have a few minutes left now, because you're all expert communicators, experts in communication. I'm sure you'll be able to fulfill this final task, which is to answer very concisely in one line our roundup question. And our roundup question this week is, what comes next? What are your biggest priorities now for public health information campaigns? Pattie, would you like to start?
Sure. Thanks. So in one sentence, I would say that we need to broaden the mental health conversation to include everyone and have messaging that is tailored and suited to different people's needs.
Okay, thank you. Alison.
You said a big challenge in one line, Niall, but I'll do my best. I was going to say that mental health, mental well-being of people around the world will be one of the key factors that brings us through this pandemic, and we have to pay attention to that.
Thank you. Okay, Ian and Suzanne.
Yes, I think one of the main challenges for us is the digitally excluded. So in line with what Pattie was talking about earlier, in the UK, it's still a big challenge for us. Maybe 10% of the population are not online, and we're focusing on that as the means to communicate at the moment. So the challenge for us is, how do we reach that 10% that are not online? Thanks.
Thanks. Suzanne, do you have anything to add to that?
No, I think just echoing what other people have said, it's that question about subgroups, so those who aren't online, but also those who are going to have difficulties as we transition through the next stages of the pandemic.
Thank you, Suzanne. Taha, biggest priorities?
So, like, I think dealing with the 80% population who are not online, and also developing tailored content for the underserved communities, like redoing research and really focusing on those communities from now.
Thank you very much. Thank you to all of you for a really great discussion today. So for those of you who are watching, the recording of this session and the notes will be posted on the unitedgmh.org website very shortly. We have another session next week, same time, and this is on May the 12th. And this will be on mental health and COVID-19 beyond face-to-face. How can we provide mental health support in the time of this pandemic? Now, as ever, you can register at the unitedgmh.org website to join and to submit questions in advance of the session. And I do hope that you'll join for what I'm sure will be another great discussion. But for now, thank you again for joining us. And thanks again to all our panelists. Goodbye.
Thank you.
Bye.
Thank you.
Thank you.